South Africa has a high prevalence of tuberculosis cases, one of the highest in the world. It remains a leading cause of death among the population. There is hope on the horizon, however. Researchers have discovered a potential vaccine to prevent TB in all people of all ages. To tell us more, I am now joined by Professor Bavesh Kana, who is the head of the School of Pathology at Wits University. Professor Kana, thank you so much for joining us. And some good news on this Friday with this potential vaccine on the horizon. Tell us more.
Thank you very much and good morning. Thank you for having me. So basically at Wits in my research unit, one of the things we've been focusing on in the last 8 to 10 years is discovering new TB drugs and new TB vaccines. So one of the areas that we focus on is trying to study the cell surface of TB bacteria. And in studying the cell surface of these bacteria that cause TB, we noticed that there was an interesting chemical change that occurred on the surface of these bacteria, which we saw was also in the vaccine strain, the BCG vaccine strain that we use for TB. And so we sought to modify the surface of the vaccine by taking away this chemical modification. And so this is quite important because that particular chemical modification helps bacteria to hide from the immune system. So if you now have a vaccine where you've taken that away, the vaccine is more visible to the immune system, and you can turn on components of the immune response that previously we could not turn on with the BCG vaccine.
So this is obviously a game changer, Prof, when we're looking at the stats as well. I mean, in 2022, we had about 54,200 people who were estimated to have died from TB, over 280,000 people who have fallen ill. For those kinds of people as well, when we talk about this potential vaccine, what does it mean for them?
So we need to maybe reflect on how vaccines work, right? So the way vaccines work is that they mimic a disease-causing agent. So if you're thinking about a viral disease, the vaccine would mimic the virus. And if you're thinking of a bacterial disease, a vaccine would mimic the bacteria. So in the case of TB, the TB vaccine comprises bacteria that mimic TB bacteria. These are very safe, harmless bacteria. And we give this vaccine to babies. So BCG is given to babies in South Africa and in many countries that have a lot of TB. And the vaccine protects very well in babies. So babies have this form of TB that occurs in the brain. We call it TB meningitis. And if a baby has been vaccinated with the BCG vaccine, that baby is protected against TB meningitis. But what happens is as we get older and move into adolescence and teenagers and as we become adults, that vaccine immunity wanes. And so whilst we've been vaccinated as babies, we're no longer protected as adults. And this is why you have these numbers, Masa. We see huge numbers of people dying of tuberculosis. And prior to COVID-19, based on death certificates, more South Africans died of TB than any other disease. So we're hoping that if we come up with new TB vaccine candidates that are more effective in adults, we can give people hope from a perspective of acquiring the disease or perhaps even using the vaccine therapeutically.
And Prof. Kana, if we could, set a bit of a time frame, when do we expect that this potential vaccine would be ready to hit the market?
So that's a good question. So currently we have a prototype where we've edited. So what we've done is edited the genome of the current BCG vaccine to remove this little chemical modification. And now this new vaccine is, as I say, able to turn on new components of the immune response. We have to get a second generation prototype that is more suitable for testing in humans. And then we have to do some safety and efficacy assessments in humans. We have done some safety studies in mice and the vaccine appears to be safe. But we're probably looking at another 1 to 2 years before we have a prototype that can go into humans with no concerns around safety.
Now, in the world of academia and research as well, what does it also mean for South Africa, for a South African institution like Wits, to be at the forefront of spearheading this kind of a project?
Yeah, we at Wits are really proud that we've been able to come up with this in South Africa. If you recall what happened during the coronavirus pandemic, there were vaccines available around the world, but we weren't able to access them here in Africa. And so it's really important that we do our own research, we do our own fundamental research and our own innovation so that we can deliver new healthcare innovations and products to our communities and be in control kind of the IP that's related to that and the supply that's related to that. And so this has important implications. If we're able to create this vaccine and produce it in Africa, for Africa, it will contribute significantly to securing the health system going forward.
And just before I let you go, currently, I mean, we just touched on those numbers as well, but where do we stand when it comes to TB in South Africa? Are we meeting those WHO targets?
Look, South Africa is doing reasonably well. Right? So you mentioned the numbers in 2022. We had roughly 280,000 people who were infected. More than half of those were also infected with HIV. This is unique to South Africa. We have a lot of TB-associated HIV. But if we look at the data over the past 10 years, there's been a steady decline in our incidence and mortality. South Africa's been at the forefront of leading important global changes in TB. We've rolled out new molecular diagnostics. Recently, we rolled out a new treatment for drug-resistant TB. We still have a long way to go. We still need more resources. But I do believe that as a country, we're heading in a positive direction.
And a positive direction is exactly what we need. Professor Bavesh Kana, thank you so much for your time and just sharing your research and insights with us.